So hi everyone, the TIS team is here with DDACL's Dr. Hung. We're talking about pregnancy and smoking. Dr. Hung's been working for Bunurong Health Service for over 10 years and has been obviously working with pregnant women that come in. So we're just going to ask him a few questions. So what can happen to the baby if there is smoking during the pregnancy?
Hi everyone. Yeah, thanks for the question. Look, I think I like to go back to basics, and I think what you have to consider is when you smoke, what goes actually inside the lung and then into the blood and then into the blood of the baby as well. So there's basically three main ingredients in smoke that we're concerned about. I think the first is nicotine, obviously. The second is a whole bunch of toxic chemicals, some of them carcinogenic, which means they can cause cancer. And then you got things like lead and carbon monoxide that actually reduce the amount of oxygen that can go around your body and, of course, around the baby's body as well. So if we talk about nicotine, what tends to happen is the nicotine will go into the baby and they will basically get addicted to nicotine. So that's not a big problem during the pregnancy, but after the pregnancy, what happens is the baby no longer has the nicotine. So they almost like having a withdrawal from nicotine. So baby tends to be more irritable, they're jittery, they're difficult to console. So basically this is like, you and I describing this as anxiety or stress. So and so they might have things like they're hard to feed, they can't sleep well, and there's certain behaviors that we don't like, which is a lot of crying as well. And sometimes we call this colic in babies. All right. So that's the nicotine side. Let's talk about the toxic chemical side. The toxic chemical side, includes things like arsenic, formaldehyde, and all that. So it's big words, but essentially they can cause damage to DNA, and that's how they can cause cancer in adults. But in babies, it's not cancer that we worry about. It's actually causing abnormality to DNA and genes and chromosomes that then lead to things like miscarriage, baby malformations like cleft palate, clubfoot, maybe heart defects as well. Smoking while pregnant also increase the chance of premature birth as well. So there's a whole host of things there. In terms of remember I mentioned carbon monoxide and lead. Both of them are very bad for the red blood cells, which is quite important. If you've been pregnant before, that we worry about anemia during pregnancy, and we always give iron when you're anemic. Well, carbon monoxide will attack these hemoglobin, the red cells, and reduce their ability to transport oxygen. So sometimes you may not be anemic on the blood test because you've got plenty of red cells. But what happens is if you're smoking, the ability of those red cells to transport oxygen is reduced. So what tends to happen with babies is that babies become very small. So they're what we call small babies or low weight for age babies, that sort of stuff. That's a technical term. But not only are the babies small, sometimes they get so small that they can't cope with the pregnancy, and sometimes this leads to stillbirth. Stillbirth means baby is born and died within 24 hours or so. So that's really tragic thing to happen. And other things that's we can't really explain through all these toxins and nicotine and so on, but they're related to the smoking is things like SIDS, so cot death, hyperactivity, so ADHD is related to babies whose mother has been smoking, and also long-term effects. So we know that small babies tend to grow up to become more obese and more likely to have diabetes as well. So so a lot of problems if babies encountering smoke during pregnancy.